Okey-dokes. So without further ado, I'm now going to hand over to Owen Davies from Social Care Wales, who is going to talk to us about the work that they are doing to help the social care sector get the most out of their data. Owen, over to you.
Thanks, Sis. Good afternoon, everybody. I'm Owen Davies. I am the Data and Intelligence Manager at Social Care Wales. I'll just spin up my slides. Somebody, Suze, if you could give me a shout when they...
Yep, we're good.
Excellent. Okay, so a little bit about Social Care Wales. Social Care Wales is what's known as a Welsh Government-sponsored body, so we're independent of government with a range of responsibilities. First and foremost, we regulate the social care workforce in Wales. There's a piece of legislation called the Regulation and Inspection of the Social Care Act 2016, RISCA, it's more commonly known as. Half of that act applies to Social Care Wales' responsibilities, the other half is Care Inspectorate Wales. So when you think of Social Care Wales, think of the workforce. So the people who work in social care, the vast majority of them, particularly those who provide direct care or face-to-face care, will need to be registered as that particular type of worker. So think social worker or domiciliary care worker, or somebody who works in a care home, for example. Each of those people is regulated. We do that part of it. The services themselves, they're regulated by Care Inspectorate Wales, so they will be inspected by Care Inspectorate Wales, and they will look at the delivery of the service itself. But we don't just do that. We have responsibility for development of the workforce itself, and that includes all of the kind of qualifications programs that social care workers need in order to be able to be registered as that particular type of worker, all the way up to the social work qualifications framework, which includes the kind of level 6, 7, and 8. So that's degrees, master's programs, and PhD programs as well for social care workers. And then the last bit, which is the bit where my team sits, is the improvement, care and support, and the development of social care in Wales. So this is a kind of really broad remit, which consists of a number of different strands. So I manage the data team within Social Care Wales, and I sit in a wider team of improvement and development and research, data and innovation within Social Care Wales. So this is from our strategic plan. So one of our objectives is framed around data, so the social care practice and policies underpinned by innovation, high quality research, data, there's that word, and other forms of evidence. So being a data nerd, I see pretty much anything and everything as data. But for lots of people, data's got particular connotations. When people think of data, they think of, lists of things and lots of big spreadsheets with numbers and databases and whatnot. But actually data, from my perspective, is just, stuff, and it's stuff that we've attempted to, or are trying to attempt to give some order to. So in terms of data, what do? Well, we manage our own internal management information processes. We've got all the kind of dashboards and reporting and all of that kind of stuff that you'd expect. We also have the remit to collect information about the social care workforce in Wales. So that's both through our register. The register's got about just over 60,000 individuals on there. But we also collect information about the entire workforce in Wales. The entire workforce is around about 85,000. So the other 25,000 is made up of the non-registered roles, of which there are many. Most of them would fall into the kind of back office, finance, IT, data nerds like me, and various other roles that don't necessarily require registration. And we also manage and deliver the strategic approach to social care data, and that includes a number of data projects and also products that we provide as well. What we don't do is probably important to understand what we don't do as well as what we do. So we don't create any data policy, legislation, or regulations. Joseph will be along later. This is part of what Welsh Government does. We don't collect data about the delivery of social care either. That's another Welsh Government function. And of course, the organisations themselves will also collect information about, how they deliver social care, and they will publish that information as well. We don't provide any data training or directly award qualifications, but we do commission and procure awarding bodies to do that on our behalf, and we do manage the kind of training content that is delivered to social care. And we don't manage or develop any data systems for use in health and care over and above our own. So we have our own internal content management systems to do our websites, and we also have our own internal customer relationship management CRM system that manages all of the registration process and everything else. But what we do try and do is to influence all of those things. So we will be involved with Welsh Government in discussions about legislation, about data policy and regulations. We will be in conversation with local authorities and other providers about understanding the services that they provide. Likewise with training, and now particularly within social care, the replacement of the WCCS system, the Connected Care programme, we're involved with that, and also other IT programmes which we'll talk about, which have got data components to it as well. Let's talk about digital. It's a growing part of our agenda. We've got an internal some internal capacity to look at that. We've got a digital innovations lead. They're currently working to understand digital maturity and literacy among social care in Wales. That's going to provide a really good baseline for us to understand what we need to do to make sure that social care is digitally capable over the next few years. We know that local authorities have been in that space for a number of different years now, but the providers of social care are in very different positions. So the bigger providers, the ones that are delivered by large third sector organisations, are likely to have digital systems to manage their work. But smaller care homes and micro enterprises made up of 2 or 3 carers might not use a computer system at all in the provision of their work. Work that went on in England a couple of years ago uncovered that about 54% of social care providers in England weren't digitally capable. So they've done some work to try and improve that, and we'll probably have to do a very similar thing in Wales. So talk about a strategic approach to data. So this kind of predates my time in Social Care Wales. I was in Welsh Government at this point. We asked Social Care Wales, whilst I was there, to investigate whether a data strategy would help to accelerate data maturity. When we talk about data maturity, we're talking about an organisation's ability to effectively use the data it holds. The answer was probably yes. So we commissioned KPMG to assist, we being Social Care Wales now, to assist us in undertaking a discovery exercise to look at the entirety of social care and how data was being used in social care, what we would need to do to improve overall data maturity within social care, and to become involved in a number of other programmes which were destined to try to improve data and data usage within social care. None of this was necessarily about bureaucratic processes, but all about improving care and support for individuals, and potentially reducing the burden that is felt by frontline workers in doing a lot of the administration of work. This presentation will be shared, so the links to the data strategy, this is the discovery report, are in the presentation. Just click on the image, it'll take you there to our website. We also created something called a statement of strategic intent. So what we didn't want to do is to create a data strategy that was all lovely and looked wonderful and was, 70 pages, but just sat on a shelf doing nothing. Partly because one of the challenges that we have is for social care, the thought of using our data much more extensively is a relatively modern concept, and we don't necessarily have access to the resources that we would like in order to be able to push this forward at the pace that we would like. We don't have access to the individuals with the skills that we need. We have tried in the past to employ people to look at specific areas of work and have failed because they just don't exist in our world. We're going to talk a little bit about that shortly. But this statement of strategic intent was a really short document that basically outlined our ambitions. It was backed by the minister at the time, and it acted as our a way that we could entice other organisations to come along on the journey with us, really, and for them to say, yeah, we kind of agree, and this is what we want to do as well. What we've learned is that we can't do this alone. We have to do it in collaboration with other partners. And those partners are wide and far-ranging, but mainly they're going to be local authorities, health boards, third sector organisation, the providers, and by extension, education, housing, various other organisations like that as well. There's our statement of strategic intent. This is destined to be updated shortly, a more kind of refreshed version. It's not going to change much. It'll just have a review. We are also releasing another update with regard to our progress on the data strategy as well, which will be available hopefully in the next few weeks on our website. Let's talk a little bit about our data projects. So they fit into the themes. These are the themes within the statement of strategic intent. There are 8 of them. I won't go through them there. Read them. There's nothing magical about these things, but these are the things that we've identified as being our main priorities with regard to data, and they fit into other people's priorities and also fit into some of the priorities that are in documents that are also kind of strategic outlooks by people like Welsh Government. So Welsh Government have got a data and digital strategy for health and care, for example, and they mention some of the same ambitions. So workforce data, I've already mentioned. We've got black and blue text. So the black stuff is what we do or have done, and the blue is what we're embarking on, either now or in the not too distant future. So we collect a lot of data on workforce. We collect it through the register, the workforce collection. SCADOOP is the social care workforce Wales development programme or something of that ilk. Fitness to practice, so that's the also part of our regulations. So if we get allegations of a registered worker having done something wrong or poor behaviour or whatever, there's a formal process for us dealing with that. And more recently, as part of the Wales anti-racist strategy, we've got something called workforce race equality standards for health and care. So those are a set of 12 measures about the workforce and opportunities for ethnically diverse people of colour within the social care workforce in health and care. And the first collection of that is in progress right now with a report, a national report on a kind of State of the Nation report being produced next year. We know that there's a lot of data out there. We know organisations sometimes find it a bit of a challenge to complete these data returns. There's still, despite our best efforts, still competing returns when it looks at workforce data within the social care sector. CIW collects some data and Social Care Wales collects some data. We're trying to make things as easy and straightforward as we possibly can to kind of reduce the burden on our providers. There are over 1,200 of provider organisations in Wales providing social care services over about 1,800 different settings. So it's a big behemoth of an organisation collectively, and we want to, reduce burden wherever we possibly can when we're looking to ask organisations about data and to provide us with data. And I know, from my time in West Government and from what West Government is still doing, that they're doing very much the same thing in terms of the data that they collect as well. So from that, we want to improve our data offer. It's been patchy up until now, so we've been producing the annual report since 2021, so this is the 4th year of us doing that. We've had some challenges over the last year, particularly with comparing our data with CIW data. That's led to the last report being delayed, unfortunately, but that's about to be released as well. But we also want to produce a lot more real-time data and information and insight that's been gathered from the data that we collect, so that people don't have to go and do it themselves. We've done all of that kind of heavy lifting for them. The other thing is, I wrote a blog about this fairly recently. I'm doing another event in a couple of weeks. In fact, I'm making maybe next week a big data event in collaboration with Life Sciences Hub and Digital Health and Care Wales. The world is shifting with data, and it's moving from kind of data analysis into data science, which is really good. It enables us to do a lot more things with our data, but we've got to be in a position that organizations are, so all well and good being able to recruit people or train people with the skills that they need in data science, but you also need the infrastructure and organizational readiness in order to do that data science. And part of that data science includes things like predictive analytics, big data analysis, and modeling. But organizations have to be ready to be able to do that as well, and they need the tools and the infrastructure. And I've had to go through the, all of the ethical and information governance considerations before they do that. But it is definitely something that we're looking at doing a lot more of. We sponsor a PhD student at the moment, and one of their research questions is all about modelling and the social care workforce in Wales. So, we've already started to do some work on that. Data portal is one of our products. We manage the National Social Care Data Portal for Wales. Its ambitions was 2018, I think it was first developed, in collaboration, incidentally, with Data Cymru originally. It was to try and bring together as much information, evidence, data as we could possibly find on social care in Wales. We've since gone through a period of kind of refresh on the kind of front end of that. We've also now very recently brought it in-house. For our last development partner, Grant Thornton, that contract ended at the end of July. So we've got a small but very skilled team in-house that is looking to keep that work up to date and do a lot more development. We've changed all of the underlying technology that drives the portal, so that is now way more in line with our corporate systems, but we still know there's a lot of work that needs to be done. So we're right at the end of doing some improvements to the user experience. It's a bit clunky at the moment, to say the least. So we've put a lot of work into that, and have done a lot of improvements there, grouping indicators, allowing different visualizations, allowing comparisons, all sorts of stuff. That's in our user acceptance testing at the moment, so it's not going to be too long until we get that sorted. Some additional functionality around contextual data, so adding text to data summaries, and more data, and also more timely data as well. National Data Resource, This is a big one. So this is a joint health and care program to bring everyone's data ostensibly into a single place so that it can be federated, i.e. shared between systems. Some of you will have heard more about this than others, depending on who you are and what you do. It's been going for a few years, but it's been dominated predominantly by health. And we are now in the next 6 months going to start to socialise the concept of NDR a lot more with social care partners and start to embark on the first steps of getting people's data into the platform. So it's not a system as such, it's essentially a data repository where all of your health and care data will live. And that data will then get catalogued, and we will collectively decide as health and care which pieces of those data need to be shared and with whom and when, so that practitioners and clinicians have got access to the right data at the right time. And, there isn't that burden of, duplicating entry, and you get one single version of the truth, etc., etc. It's been tried before a number of different times and failed. But there are big differences in the way that it's being done this time. There's something called FHIR, FHIR, stands for Fast Healthcare Interoperability Resources. That's not a piece of technology, it's a framework that describes how data can be shared between systems. It uses, machine readable and human readable format, so it's much easier to understand. But there's also a lot of flexibility built in, and where previous interoperability has failed is because it forces organizations to work identically. You have to work in exactly the same way, otherwise these things won't work. FHIR allows for a little bit of flexibility. There's again a blog that I did on the website which explains what FHIR is and how it works in a kind of page, but there's a lot of resources on the internet should you want to get your nerd hat on and have a look at it. It's managed by a non-profit organisation called HL7, and it's also been decided by all 4 nations in the UK that they will use FHIR for health and care interoperability. It's also used in Australia and the USA and various places in South America and Europe. So it's a growing standard. Lastly, there's our administrative data research. So ADR, we work in collaboration with the Sale Data Bank, Swansea University, funded by Welsh Government, to do linked data research. So I'm sure most of you have heard of the Sale Data Bank. We manage the ADR programme on behalf of Welsh Government for Social Care. We've got 2 dedicated researchers who are loaned to us from Swansea University. They've been doing a lot of work on priority setting in adult social care, and also relationship building and building a network of researchers who are interested in undertaking linked data research in social care in Wales. I mentioned the PhD. This is a different PhD opportunity. This is for people who are undertaking their PhD in a Wales university who wants a placement with the Sale Data Bank in order to do some social care linked data research. They'll come and work with us for either 3 or 6 months, and I think that opportunity is open right now. If you know anyone who's doing a PhD, or if you're doing a PhD yourself. Over the next year, we need to start to build up more relationships with the people who hold the data about social care in order for us to acquire that data for use within linked data research. So that's one of the most challenging aspects, isn't doing the research itself. They've got really skilled researchers and data scientists to help you to do that. One of the biggest challenges is to get access to the data in the first place. Some other work that we're doing internally, so we've got a new research innovation and improvement strategy called amlygu'r. We also collect a lot of qualitative data and do a lot of surveys. So one of the biggest ones we've got is the Have Your Say survey, which asks the entire social care workforce a number of different questions about various things. We've got an Insight Collective website, which is a kind of sub-domain of our main Social Care Wales website. It's Insight Collective, all one word, .socialcare.wales. That's where the work of my team and my colleagues in research, data and innovation live, but also we're going to be launching the improvement aspects of our work on that website as well soon. If you've not been there, go and have a nose. On that website is a training resource library. We know we need to do a lot with skills and a lot with data skills across the public sector. Again, this is another area of work that we need to share resources in order to be able to get better with data. We did a piece of work with an organisation called Social Finance, looking at work they'd done in England to create a specific apprenticeship scheme for analysts in children's services, but also whether a professional framework would help us to ramp up skills within social care. The answer to that was no, and you're probably not big enough to do a bespoke apprenticeship program, but you've already got apprenticeship programs that you could and should be using. So there are apprenticeship programs available in data science and data analysis that organizations can use, plus a load of training. We're not short of training for data skills. It's everywhere. The big challenge is curating that. So the training resource library is an attempt to start to do that. And finally, we've recently done a data maturity exercise. We're also doing that digital maturity exercise that I talked about. And then the links to work that elsewhere, a bit of engagement and data promise. This is about speaking to people, but using their data. We know if we don't, then things go wrong because people don't trust organizations to, by collecting the most sensitive data about individuals along with their healthcare. People need to be reassured that we're doing the right thing with that data. But the Advanced Analytics Board, we do some training courses with them. Said we don't deliver training, but we do get involved in doing that, and that's available for use for social care partners and local authorities. Anyone else who wants to go on there, we've got a number of programs on there. So the Analytics Learning Program, and also more recently we've been piloting stuff for senior management. Mentioned fire, that's the lovely meeting that I go to, the HL7F Fire UK Co-SC. It's just basically people from the 4 nations getting together to talk about common standards. NDAP is part of the NDR, so this is the bit where all of the fancy new tools and secure data environments where we can do data science on social care data will exist. Care and Cascade are our 2 national research partners, one for adults care, very recently opened, and Cascade, which is part of Cardiff University, been around for years, and then 2 other things that we're going to be doing soon. So GitHub and Google Cloud partners. So this again part of the NDR. GitHub is a collaborative space for coding and developing reports and stuff to do with Power Platform and .NET and all of those kinds of things. Google Cloud is the platform that's been used for the National Data Resource. So you've all have heard of Microsoft Azure and maybe Amazon AWS, Amazon Web Services. Google Cloud is Google's version of that. It's just a cloud platform, but it's got a lot of really interesting tools on there, including stuff about machine learning and AI and all of that kind of stuff. We're also looking at communities of practice. So community of practice are people with a shared interest getting together to discuss things in an online kind of forum style platform. We've already got these for some social care topics, and we're going to kind of emulate the success of those with some DDAT, so data, digital and technology subjects that people can kind of dip in and out of when they so want to. So that's it for me. If you want to know more, there's a QR code that you can point your phone at either now or when you get the presentation afterwards. It'll allow you to tell us who you are, who you work for, give us your email address, and choose some of the interests that you've got with regards to social care and data so that we can tailor what we send to you. If you don't click on any of them, we'll just randomly send you stuff until you tell us to not do it. But you can just choose as many of those as you want. So thanks for your time this afternoon. And I'll hand you over now to Joseph from Welsh Government.
Thank you, Owen. Can you hear me all right?
Yeah, we can hear you.
Great. So I ddechrau, mae ddwgynnu, dwi ddim wedi bod defnyddio iawn. Mae fy slidio yn Saesneg, so byddai'n rannu slidiau Gymraeg ar ôl y digwyddiad, gobeithio bod hynny yn iawn. So hello everyone, I'm Joseph Wilton, and I lead the data and research team here in Welsh Government for social services. So I'm going to try and share my slides and hopefully that'll all work. There we are. Is that visible?
Yeah, all good.
Great. So hello everyone. First of all, I want to say possibly not as innovative and exciting with the new technology as Social Care Wales, but I'm going to talk you through what we do here in Welsh Government in terms of social care data. So I'm here today to represent the statistical teams that work on social services here in Welsh Government. We're a bit of a collection of different functions. So some of the functions we have is that we first of all oversee the content of the social services data collections. So you may be experienced with Stats Wales, and there's a lot of data on Stats Wales about the people who receive care and support in Welsh Government, and in Wales, sorry. And we have one team that works very closely with the local authorities to bring all that data in, to cleanse it, to validate it, and to get it published on the website. We then also work very closely with local authorities to explore what they can provide, the issues they might be having, talk through any potential changes we need to make. And then we also work with quite a lot of stakeholders across Wales to understand what the customer needs are for data, how they use it, and how we can potentially make improvements to make life a bit easier for everyone. Obviously, as I'm sure you're aware, we also need to respond to requests or recommendations that are made to Welsh Government in terms of improving the way we collect data. So quite a lot of this comes through independent inquiries or reports or that suggest ways in which we can make things better. So as I said, what we do largely is we focus specifically on the people who receive care and support. So this is either people who have a care and support plan. So this is adults or children who have a care and support plan with the local authority or have received any support from the social services department in the local authorities. So we work very much exclusively with local authority data. The data is validated to make sure it's all complete and meets the quality standards that we have. And then we try to make it as accessible and available to everyone as we can. That's normally through Stats Wales, but we also work with Administrative Data Research Wales and the Sale Data Bank that Owen kindly mentioned to try and make the individual level data that we collect, the personal identifiable data, linkable within the Sale Data Bank so it can be used to its greatest effect by linking it to other data sets such as health data or education. We also have the separate function of developing the policy and the oversight in terms of social care data and research. So we set the national direction for the uses and collection of data. We work with other organisations such as Social Care Wales, Administrative Data Research, the research organisations that Owen's already mentioned to help develop a strategic direction for data and social care research. We also do, as I'm sure you're aware, as Welsh Government, we issue funding. So we have funding lines to local authorities and to other organisations to help support them in the collection and provision of data. As we're aware, and as Owen's already mentioned, data collection and provision can be quite a big task. And so we do try very much to reduce the burden on different organisations, but we do make quite a large ask of quite a lot of organisations, and so we try to issue funding to help support them with that ask. And we also then work closely with Social Care Wales, who are a key partner for us on their strategic approach for data. So I'm just going to talk you through some of the data that we do collect, because this is really the mainstay of what it is that we do. One of the ones that you might be familiar with is the Performance Improvement Framework activity and performance data. This is quite a large data collection, which is an annual collection and tries to cover the full range of social services activity. I'll providing links at the end of the presentation, but this allows you to look at children's, adults, and unpaid carers to try and explore what services being provided. It covers things like safeguarding, reviews, children looked after, everything that the local authority provides to children and adults receiving care and support is covered within this data collection. We publish all that data on Stats Wales once it's been validated. The latest data we have on there is currently 22-23. We're expecting the next wave of data to be coming out sometime in the next 3 to 4 months. So that is published. What we don't publish at the moment is our monthly data collection. This is focused very much on the capacity and demand on local authorities. It is currently a data collection that we have set up for the benefit of local authorities and for other national stakeholders, so that we can try and recognise issues and pressures that exist. It was originally brought about through COVID, and it was identified as being very useful. So it was so helpful to helping different teams to know where pressures are arising that we decided to keep it. But the plan is that we do start to publish this data in the near future. So they were the aggregate collection. That talks about the numbers of people doing different things. We also have some individual level data collections, which are more about understanding the population. The two that have been up and running for quite some time are the children receiving care and support and the children looked after censuses. So these are quite detailed data sets, which ask about the individual details of children, including their demographics, the reasons they're in care, and the factors about their care. The children receiving care and support census about all children that the local authority provides care and support to, whereas the children looked after one is all those who are in care. So this covers things like foster care primarily, but also those children who are in residential care homes, but then also care leavers and those children who are transitioning out of being looked after. And that's a very detailed data set that's based on the episodes of being looked after and how long they last, the reasons that they're there, and where they're placed. These data sets have become so valuable for the research organizations. So there's quite a lot of funding bids that go in to use this data specifically. However, it's not all about children. We have implemented a new adults receiving care and support census that was initiated over the last couple of years. We have not yet published any data on this one, but the first data will be covering 23-24 and is due for publication towards the end of this financial year. It is very similar to the children's one, that it covers all adults with a care and support plan. And for those of you familiar with adult social care services, that is quite a lot of adults. We're estimating about 50,000 adults are currently going to be captured by the census. And those will either be largely in a residential care home or being supported through domiciliary care support services. So we're quite excited about that one, and I think it will give us a new insight into the people that receive care and support that we don't currently have. We are currently, though, working on a new data collection for unpaid carers. This is not, if anyone's worked in this area for a while, you'll be familiar. There's not a huge amount of data about unpaid carers. While there are bits and pieces in different areas, we're trying to make sure that they receive the same level of attention as the people receiving care and support. because they are obviously a very valuable part of the social care puzzle. We're currently developing that guidance, and we're anticipating the first wave of data to be about 25-26. So this will probably not be published now until for another 2 years. But fingers crossed, everything will go smoothly and we'll be there in 2 years. So several ways you can access the data. The main one is through Stats Wales. I've provided some links in the presentation, which you can obviously access later. But if you go on Stats Wales and find the health section, there'll be social care under there. If you're working in a local authority, then you should already be able to access the checkpoint data. This goes out to a number of different teams within each local authority. If you don't currently have access but would like to, I'd recommend speaking to your social care data teams, whoever they may be. And lastly, if you want to get more information, just get in touch with us. More than happy to answer any queries or point you in the right direction if you have any issues. Email is the best, I would suggest, and that's at the end of the presentation. I did want to wrap up with some of these known data gaps, because I'm very aware that the title of this webinar is about improving the outcomes for people who receive, for the most vulnerable people, which is those people who receive social care. But prevention is a very big part of transforming outcomes, because ideally we would never have to provide services. There are services out there that allow people to prevent their escalation of need, but we know so little about it. So that's one of the areas that we're currently working on. At the moment, almost all our data comes from local authorities, which is great for those people who are being supported by the local authority, but there's about 20-30% of people who receive social care pay for their own care and may not go through the local authority. So they're a bit of a blind spot. And while we do have some data captured through CIW through their annual returns, we know far less about this group than we do about the people that the local authority is supporting. But lastly, we need to do more to understand experiences and outcomes, because at the moment our data collections are realistically what service is being provided, but it doesn't tell us about people's experiences of it. It doesn't tell us about how the impact that's actually had on those people. So we're working with nominated representatives from local authorities to start understanding how we move this forward, what options there are to understand people's experiences and outcomes in terms of social care, and how do we use that information to then actually make change and improvement across Wales. So a number of ways you could get involved if you are interested. We have monthly meetings with all local authorities to discuss the data collections, and we focus on the Welsh Government collected data. But if you have any, if there's anything you want to talk to us about within those meetings, that would be great. You're more than happy to come along. We also have a working group set up to develop the local authority annual reports, which is where the accumulation of evidence and information collected goes in terms of what the local authority is doing and how they're supporting people. And we have a working group to develop guidance and to raise issues and develop FAQs to start helping people and use these reports and to make sure that they are consistent and to helping meet the need that we have. We also have a research network that I mentioned. We have one which is for the local authorities, which is for people to get who are involved in research. And we have another which is more of a research-focused organization. So we work with a network of people who and organizations who are involved in social care research to share best practice and share updates so that we can make sure we're all working together. So thank you very much. I hope that's been useful and informative. I'll be more than happy for you to send any questions to me.
Absolutely. Thank you ever so much, Joseph, and thank you to Owen as well, who hopefully will pop back up on screen in case there are any questions that we do need to respond to. So as I said at the beginning, if you've got questions now, please feel free to put them in the chat and we'll address those. I've got one question inevitably, because I always do it for Owen, actually. It's quite a detailed one, so forgive me. But obviously you mentioned at the very beginning that you collect a lot of workforce data. Where would we go to find that? Is it in the social care data portal that you mentioned?
It is. Partially is I'm going to straightforward answer. Actually, it is quite a complex
I'm
answer.
very sorry, I didn't plan for
complex
this.
question.
So,
We've done a lot of work recently to import our registered data into the data portal. So the registered data will be available when we do the upgrade, which will be in weeks rather than months' time. So registered data will start to become available there. It's quite basic to start off with. The benefit of us putting registered data there is it allows us to automatically update it on a monthly basis. The wider data that we collect, it's only available in report format at the moment. So we produce a report each year on that. We're just about to embark on a review of that process, as I mentioned, with CIW to be able to collect it more efficiently and effectively. Ultimately, that data will end up on the portal as well. But for the moment, it's only available in kind of report format.
Thank you. And one more question. The Have Your Say survey as well, is that information that's published, or is that much more for internal purposes?
We did a pilot of the survey last year, so this year was the first full survey. The report's been written. That's currently going through our approvals process, so that'll come out, I believe, in October. We will as well eventually publish more granular data on that on the data portal. We've got to decide what and how we publish, because obviously there's a lot of information on there that is very sensitive, and we've got to deal with small numbers and suppression and all of that kind of stuff. We're also working with a university partner to deliver this at the moment, and obviously the university has got their own ethics board, so we're currently working with them to determine what parts of the data we're able to publish as well.
Thank you very much. As a data nerd, I always like to know where the data is, so thank you very much. So just once again, just to reiterate, if you do have any questions, please feel free to put them in the chat, otherwise we'll be getting 5 minutes back. So we'll give it a minute or so to see if anybody wants to raise any questions. But while we are waiting, I guess I can say now, just again, thank you very much, both of you, for giving your time up today. I'm glad you managed to tie it back to the title of the webinar as well, because I was very conscious that I'd given you quite a broad kind of title to match it to. So really grateful to both of you for doing that. There are no more questions, so we will draw it to a close. But what I'll say is, if after the event, obviously you've got the contact details there anyway, if you want to contact either Owen or Joseph, and obviously you'll have ours as well through the invites to the webinars. If there are any other questions you want to send through, either kind of via this chat, it'll stay open for a short while, or obviously there'll be emails then that you can do that with. Otherwise, just to say thank you to all of you for attending. I hope you found it useful today, and just to remind you to go take a look at TicketSource on a regular basis, just to see what other webinars we've come up. And like I said, the next one we'll be looking at the National Residence Survey. I would highly recommend you coming along to that. And then just lastly, once again, thank you both to both speakers, and thank you to attending, and goodbye.